to everybody. I'm so excited for today's topic. Like everyone else, I've had many sleepless nights and I am keen for any and all professional advice. The success of the series is thanks to the leadership of our amazing board of directors. American Friends of Soroka is a community of leaders coming together from diverse backgrounds to support one of Israel's most important and vital institutions. Each brings to us a world of expertise and commitment. Dr.
Mute yourselves, everybody.
Okay, there. Dr. Jay Selman, MSMD, is the president of American Friends of Soroka. He is also a pediatric neurologist and professor of clinical pediatric neurology at Columbia University. Dr. Selman has been steadfast and nimble in his support of our work during these trying times. His professional expertise and remarkable leadership skills are truly an inspiration. We are thrilled today to have this opportunity through our Ask the Expert series to share with our friends and supporters medical news to keep them safe and informed throughout the pandemic and beyond. Thank you to Pazit Levitan, who is the Director of Development at American Friends of Soroka Medical Center, and the entire board, who have been leading the way to find innovative ways to continue to support Soroka during the COVID pandemic. Soroka Medical Center is the sole major medical center for the entire south of Israel and is responsible for the health of 1.2 million individuals. During the COVID-19 pandemic, Soroka has emerged as a true global leader and role model, implementing safety protocols, building an isolated emergency hospital, and establishing a comprehensive testing program for the thousands of Negev residents. Our latest clinical research study is in collaboration with the Israeli Air Force Industry and Microsoft, focusing on telemedicine, translating our innovative work in safety during the pandemic into a comprehensive data collection and analysis system using artificial intelligence. I invite you to learn more about us at soroka.org, where you can read the latest news, sign up to receive notifications about future events just like today's, and also learn about ways in which you can support us. We're in the final stretch of a crowdfunding campaign initiated with the matching gift by Dr. Jay Selman and his wife, Batinka Kopek Selman, to acquire special devices to monitor patients' vital signs while protecting the team during COVID. And these health monitors are also used in our emergency room, which is the busiest in the country. Your help in this campaign will be truly life-saving. So that's soroka.org/COVID. And now I am honored to present to you Dr. Jay Selman.
Rachel and Pazit, thank you so much. And Rachel, thank you for your kind words. Well, sleep. We cannot survive without sleep. The quantity and the quality of sleep affects how we think, feel, and function during the day. Sleep is also an integral part of our health. We can think of sleep in terms of falling asleep, staying asleep, and staying awake during the day. When we encounter medical stresses, life stresses, and/or external events such as COVID-19, sleep often suffers. But there is hope. We can improve our sleep. Today, we're blessed to have two experienced sleep experts who will share their knowledge on sleep. They will help us distinguish fact from fiction and answer questions from those who are attending this. First, let me introduce Dr. Shelby Harris. She is a psychologist with additional training in sleep medicine and CBT, or cognitive behavioral therapy. She was working and has been working in one of the oldest sleep medicine clinics in the world at Montefiore Hospital. She completed her PhD at Yeshiva University. She is now in private practice in Westchester County, which is north of New York City. She authored a special book called The Women's Guide to Overcoming Insomnia. This is a book on insomnia for women. Shelby, thank you for joining us. And we also have Dr. Ariel Tarasiuk. He's director of the Sleep-Wake Disorders Unit at the Soroka Medical Center in Beersheba, Israel. Ariel, thank you for joining us from Beersheba. Ariel completed his undergraduate and graduate degrees with a PhD from Ben Gurion University, which is also in Beersheba. And this was followed by a 3-year intensive fellowship in pulmonary medicine and sleep disorders at the Long Island Jewish Medical Center in New York. Since 1993, he has been on the faculty of Ben Gurion University and the Soroka University Medical Center with a rank of professor of physiology. His research focuses on the basic science and clinical management of sleep disorders in children and adults, and the development of advanced techniques for the diagnosis of sleep disorders. Ariel has published widely. Again, thank you for joining us. I will now turn the program over to Pazit Levitan, who will serve as a moderator. Pazit?
Thank you very much for the introduction. And I've been reading Dr. Harris's book. We're going to start by a brief presentation from each one of the two presenters, and then we're going to address them with some questions that we've been receiving through the email, some anonymous, some questions that we've received more than once. Then we're gonna open to your questions. You can either raise your hand physically, old school style, or put it in the chat and we'll try to address. One caveat, where our two experts today do not prescribe medicine, so please don't expect them to talk about medicine, okay? But they have a lot of very effective tips and guidance and motivations to share with you. So, Dr. Harris, yes, can you mute yourself? I'm gonna mute everybody now, and co-host, please unmute yourself. There we go. Okay. Co-hosts. Okay. Dr. Harris, you have here one sentence. You have many chapters, good chapters, but it says in the introduction, sleep, health, mood, and quality of life all go hand in hand. Yeah. Can you please address that and present a little bit what's going on in your practice among your patients, especially now in recent weeks? Thank you.
Thank you. Thank you for the introduction, everyone. I think since we're starting to slowly come up to the 3-month mark here in New York, where I'm located, since COVID really changed our lives, everyone's lives here, I'm starting to see much more of the mental health and sleep struggles come out, more and more new mental health issues, new sleep struggles come out. From a sleep perspective, I think I'm seeing more and more patients who are coming to me with new incidents of nightmares as well as insomnia. So what we normally see is that at the beginning of a stressor, and let's face it, can do on a daily basis, is very stressful for many people. What we find is initially stress like that is normal. It's going to make your sleep disrupted. But after a while, we start developing habits to try and cope with the fact that we're not sleeping. So people's sleep schedules start shifting. We start worrying more about the fact that we're not sleeping. We start using things. We start thinking a lot more about it. And so all these things start to happen, and some people start to normalize. Their sleep normalizes as COVID, in a weird way, the self-isolation becomes the true. And for other people, those coping behaviors with their sleep problems actually becomes more of what's maintaining some of the insomnia. So now that we're coming on 3 months, I'm starting to see people who are developing early chronic insomnia, and they're coming to me for that. The other thing I'm seeing a lot of is just mental health struggles. I'm seeing a lot more people with anxiety, depression. I'm seeing, like I said, nightmares, and I'm also seeing some early stages of PTSD really start to come out, because I see a lot of first responders, physicians, and it's mental health and sleep. But on the good note is that people are really utilizing telehealth. So over the past few weeks, people are calling, they're willing to start talking over the computer, and it's actually working really well. Connection happens, and there's effective treatment really available for many people. Oh, I can't hear you.
Thank you very much, Dr. Harris. And now we're going to move to Dr. Ariel Tarasiuk from Soroka in the Negev, Israel, who can update us a little bit about how sleep disruption and sleeping disorder is being addressed in Israel.
So first of all, thank you for having me. First, we should know that sleep, the word sleep actually existed from the time of the pharaohs, the great pharaohs of Egypt. This is when the first time it was mentioned in writing. And even then, they know that tell me about your day, so the day starts with good night rest. We all know it. And we know that sleep very much determines our daily schedule. Between if I have to catch a train to somewhere else, so normally I plan ahead about my sleepy time before I will go. And now came the COVID-19, which actually in Israel locked us down. In my area, we were locked down for, I think, 6 weeks. We were shut down because it was ambulatory and we are mainly dealing with pediatrics. And people ask me, oy vey, what shall I do? Because we are not in our schedule. So I said, what there is to be worried about it, because there is no school tomorrow. So just enjoy the moment. How much opportunity did we had at the past just to be recreational with our family and try to manage sleep that way, since tomorrow you're not going to work anyhow. So this took actually a lot of the anxiety. And since anxiety and stress went off the board, so people actually, since it's also going into summer, started shifting into late bedtime and late wake up, and everybody shifted. And this was normal because we did not have to catch the yellow bus for school and other obligation. So we all coped. However, it does change our eating behavioral, and sleep, as we tell our students, is not the 1/3 not knowing what to do in the day. It's actually the 1/3 that determines our learning and memory, our mood, as it was mentioned, our well-being and quality of life. And it also determines the way the body regulates energy metabolism. And sleep deprived, poor sleep, leads to, I would say, less controlled eating behavioral, which may lead to weight gain and changing energy metabolism. Now with the world pandemic, not COVID, but I meant obesity. So COVID and obesity goes actually together because COVID locked us, locking made us sleep something changing, and this led to eating. So yes, it happened, but we actually advocated that try to watch TV at your living room, although quality of life and being able financially to support, it's not recommended to have a TV in bedroom. And after a while, shut down the news channel and try to move into something fun to do prior to sleep, which means to get the body, think about it as diving, to decompress yourself from the day-to-day activity and try to get into a sort of a mood of going to sleep, and watch the news in the morning and try not to get all your worries prior to bedtime. For most of the time, it helps. For most of the time. Of course, now Israel is unlocking itself since Passover and the Memorial Day finished. It was like 10 days ago. So now not everybody is locked down, and some people have different scheduling. So as it was mentioned a while ago, so now the whole family needs to go to its own tempo again. So it leads to a little bit of stress, and we actually hear about it, depression, all these things. But the good thing about it that it will pass in no time.
Mhm.
Like, give it 2 more months and we will forget that we had it.
Thank
To
you
my
very
opinion.
much. Thank you very much, Dr. Tarasiuk. And you mentioned here taking the television out of the bedroom. And I also read in Dr. Harris's book and also a guide that we can share with you afterwards if you put your email on the chat, either to everyone or just to me, Pazit. We can share a guide, a written PDF guide with you that Dr. Harris and Dr. Tarasiuk put together. But Dr. Harris, I want to ask you about that, taking the television or all the electronic outside of the bedroom and dedicating the bedroom, you said in your book, to sleep and sex, right? But I want you to elaborate about that. And especially there's one question here from anonymous question from a participant saying, you know, what put her to sleep is actually watching television and reading Kindle. I know others said what put them to sleep is browsing, you know, on the internet, on their laptop or iPad in their bedroom. So please address how to change these habits and whether it is reading a Kindle, is it that bad?
Right. So the reason that whole rule came up is from the early 70s. There was a study that looked at essentially controlling the room only for sleep, so that people, when I give a quiz, a little pop quiz to some of my patients who have insomnia, I say, what's the first thing you think of when you think of your room or your bed? And most of my patients, sleep is not the first word that comes to their mind. It's insomnia, tossing and turning, rest, TV. It's not sleep. And that's what the bed should be about. So the idea of the rule is that it's come to be is that if you only sleep in bed, you're going to likely increase your chances of training your body that the bed is only for sleep. Now, the misnomer is that people think that if you get out of bed and you read or you do something quiet, calm, and relaxing, you're going to get sleepy and then it'll be like the magic cure. Most people will complain that I get up and then I wake up again and I have trouble going back to bed and then I don't fall asleep. It's more about getting out of bed. It's just so that you're not laying in bed, tossing and turning awake and training your body that that's what the bed's for. So a lot of people who will say things like, use an iPad to quiet my brain down, it's because you've trained the bed that the bed is about things like thinking, being awake, tossing and turning for a long amount of time. So if you're laying there awake, get up, go sit somewhere else, do something quiet, calm, relaxing. The idea of the screen.
We're hearing, am I the only one that's hearing?
Meant to do.
We cannot hear.
Okay, Dr. Harris, you're coming in and out.
Oh God.
Her internet connection.
Get close.
You hear me?
Now, yes, but
you hear me? Okay. So the idea is that if you get in bed and you should fall asleep right away. You should within a half hour. That's it. You shouldn't need anything else to rely on. But that being said, if you're reading, if you're doing something for a few minutes, it's okay. But I prefer people not have screens because you're training yourself to need something else to fall asleep. If you can, do something that's not blue light because that can worsen the depth of your sleep as time goes on.
Thank you. There's a continuous to this question, and Dr. Tarasiuk, I will let you address it as well. In the technology and in the bedroom, you know, a lot of people have that because we're now reliant on technology and we're more at home. What about listening to podcasts and even music, relaxing music as you go to sleep? So if Dr. Tarasiuk, you have anything to talk about technology, television, and even reading Kindle and listening to calming music and podcasts, guided meditation or whatever.
Let me start before that. So technology and sleep do not go together. The invention of the light bulb a decade ago by Thomas Edison took 1 hour from us. Television in the living room took 1 additional hour. And then there was a nice study by European adolescent, which actually they recruited like 4,000 adolescents and found out that looking at this computer, which is my mobile phone, and looking at SMS, like text messages, so the more text messages adolescent and people picked up, actually sleep deprived them and took down their academic activity. One way to look, and at the old time, even now, if you have an alarm clock, like a clock in your room, and the clock is ticking, like the old clock, and you are watching the clock, so watching the clock, speaking about old school technology, also makes us sleep deprived. Now, there are some ways to find out why. First of all, I'm looking for something, so my anxiety or my alertness goes up. So you should look at sleep as physiological need, but also behavioral. So if for behavioral, we need to send signals which will actually put us in a mood towards sleep. So you mentioned, for example, soothing and calming music. So the rationale for that, actually, there are several good studies that show that listening to certain monotonic music can actually synchronize our mood or activity toward initiating sleep. And there are studies who claim that sleep may even get deeper with that. And Felix Respironics and other companies are trying to make money out of it. I'm not advocating for any of these. There are evidence to suggest yes and no for that. Me, for myself, do not like to listen to nothing. I would like to get complete darkness and complete silence. Some people are used to sleep with small light and some noise in the room. But when people tell me I do not sleep well, so first thing I say, are you sleeping with closed window or open window? Yes, open window, and I'm near a cross section of the road. So come on, close the window, get your room into a mood and get some sleep. So technology does not go very well with sleep, although there are studies showing in some children with neurological shortage, some disabilities, this type of music actually help them.
Okay, so talking about getting ready for sleep.
Yeah.
And you mentioned, for you like to close alone, quiet, close the window,
Yes.
open the window. What other things can we do? There's a question here from one of the participants. What other things can we do? How do you actually get ready for sleep? Yes, Dr. Harris?
Yes, sorry.
I mean, there's a whole bunch of things. I always think of it like a ritual. And if you find a ritual that works for you, you're preparing your body for sleep. And especially with kids, you want to work towards the bedroom. So if you have kids that are having trouble with sleep. But for me, I like to do some meditation, some gentle like yoga stretches, things like that, about a half hour to 45 minutes before bed. I read a book. I always say go old school. Like everyone has to have everything on a phone nowadays. No, just read a book with a book light. Something quiet, calm, relaxing. A lot of my patients right now who are having their mind very active, they're doing a lot of puzzles, like the jigsaw puzzles. Adult coloring books are great. Find something that works for you that's not in front of a phone where you're obsessing about the time or social media, and then get in bed at a time when you're actually sleepy.
Thank you. Dr. Tarasiuk.
So sleep needs to come to you. You cannot come to sleep, which means if you are downloading or like shifting gear towards sleeping zone and you are preparing the body, sleep will actually fall on you. It's not something which you can force it. So when people tell me I cannot fall asleep, I don't know, I count sheets for hours and they are walking all over my vision. So I tell them, okay, so next night, instead of planning a sleep, assume I'm just making up for 8 hours, you are going to sleep just 6 hours. You are going to set sleep and you are going to sleep deprive yourself to fewer hours. And if you do it for 2 or 3 days, eventually you are slightly depriving yourself from sleep, and your body the next night, and it actually can take like a week before the recipe is coming, you will fall asleep. Sometime in the worst case, I tell you, you cannot sleep, be brave, skip bed altogether. Have a white night. Do whatever you think you want to do. Do not fall asleep, but do not take afternoon naps the other day. So you're going to skip a whole 24 hours. And this is the magic pill. Because after skipping and being alert for 24 hours, the next day they are falling asleep like magic. Now, when people are telling us, I cannot fall asleep. So I say, look, you need to tell me something about your day-to-day activity. Is there enough light in your home or apartment? So I say, no, I'm like 60, 70, we are senior citizen already. We still have our romantic light when we used to be young. So I said, look, with age, our eyes are not so clear. We have cataract and all this bullshit. So all you should do is change the light bulb in your apartment. So when you have in this apartment, you should have bright light, because good light actually breaks down the melatonin and you are alert. Now, when come nighttime, you should keep your bedroom with a dim light. So what we tell them, if you're insomnia, try to stay a little bit out of bed, go when exactly you're awake. Do not force sleep, sleep will come into you. Try to shorten your sleep. Try to be during the daytime, if possible, at sunlight. And if we are under lockdown, try to go into the terrace or, even for 20 minutes exposure to sun. It actually synchronizes our sleeping circles. And if you are going to plan, assume going to bed 11, I'm just making it out, do not have good and stuffy meal half an hour before bedtime. At supper, you should try to have light meal. Do not stuff yourself, because overfeeding, it's two different biological mechanisms that are like trains driving one toward another. And sleep will not, it's bad for sleep.
Thank you very much. We have Dr. Selman raising his hand with a question, please.
I think the material that Shelby and Ariel have provided are really helpful. There are a couple of other thoughts just to amplify. Number one is that bright light in the morning, especially sunlight, helps to resynchronize our internal clocks. Second of all, exercise in the morning especially, but if it's in the afternoon and not in the morning, that's still better than no exercise. And the third is that we should think of a decrescendo. So for those like music, that means getting softer. So we should go from a higher level of activity and mental engagement to a lesser level of activity from dinner onward. And we have to ask ourselves, are we a worrier? So during school, the teenagers say, well, I'm not sure what I'm going to wear tomorrow. Oh, I can't forget to put the homework in the backpack. So do things that you can do for the next morning to declutter your brain. Pack your book pack. Pack your briefcase if we were going to work. Make a to-do list. And the other issue which has been touched on is the hypervigilance. Having screens in the room, especially the phone that dings when there's a message, that tells our brains to be on high alert. Many of the screens that do not have blue filters also simulate daylight. So it's just the opposite of what we want. So I think these are some additional things to keep in mind.
And I'm a huge fan personally, just to add in, of meditation. So if you tend to find that you're a worrier, and despite taking care of everything, you still can't keep your brain from worrying about whether you're going to sleep that night or anything. Or I always call it like the puppy dog mind. Practicing meditation, especially during the day or the afternoon, is excellent. A lot of people are using a lot of the meditation apps like another phone, and they put it on and they're looking at it and they're falling asleep to it. And that's not the way that they really should be used, because then you have another screen in front of you. So practicing meditation earlier in the day is like you're strengthening your mental muscle to help be able to focus in the moment on what it is you need to do. So if you're going and practicing it during the day, when it's time at night and your brain is the puppy dog brain, you can get in bed, practice a little bit of deeper breathing or whatever it is you want, and notice the puppy dog mind, but redirect it because you've strengthened the muscle by practicing it a lot during the day.
Thank you. I think we covered, there's so much more to cover about how to fall asleep. Let's say we succeeded, we did our meditation and we closed the window and we calmed ourselves down much before going to sleep, and we succeeded, we're now asleep. But what about when we wake up? The sleep is not deep. Whether we are worried about something and we're just waking up in the middle of the night more than once, with sometimes the urge to eat or to do or to check our Facebook or whatever, or whether it's even somebody snoring or we're snoring and waking ourselves up. How do you deal with, and I'm sure it's more than one topic, snoring, non-snoring, how you wake up, stress. How do you deal with waking up that you can't really, after falling asleep, you wake up, your sleep is not deep? Dr. Harris.
I'll just take one point, and I'm sure that others can add on. But one of the things I always first target when someone says they wake up a lot in the middle of the night is I look at how many hours are you actually spending in bed at night, though. Let's say someone only is needing, right now, they're only getting 6 hours on average a night, but in chunks, but they're spending 9 hours in bed. Then they're going to get it in chunks. What we find happens, what was alluded to or spoken about before, is if we actually have someone go to bed later, but wake up at the exact same time and get sunlight and everything in the morning, and you keep that fixed schedule, it actually deepens your sleep for some people. So it's that anti-common sense thing that I was talking about when we first got on. Spending somewhat less time in bed, going to bed later can deepen your sleep, reduce the amount of awakenings for some people. And then if you do awaken, you tend to fall back asleep faster, but you have to get up at the same time and keep that schedule. And once you start doing better, then you can slowly open it. But that's always the first thing that I look at. I don't know if my colleague has anything he wants to add on it, but the other thing, yeah, go ahead.
Yeah. So sleep, the amount of sleep depends on age, meaning that children will tend to sleep more, adolescents will tend to sleep slightly less or shift their sleep. And if we are elderly, people tend to sleep less. So sleep need is essential through life, but with age, people have hard time sustaining sleep. So elderly will tend to have bimodal sleep, which means sleep at night and take an afternoon nap. And when you are at your 20s, so that you sleep the whole day. But elderly sleeping bimodal sleep, it's no good, because sleeping in the afternoon will actually take quality of sleep at night. So when people are saying, I'm not sleeping very efficient, first thing is we tell them, try to shorten as much as possible your afternoon naps. And secondly, go to sleep when you're ready and try to shorten sleep. And what actually helps a lot, and even if we are at our home or at our apartment, try to exercise.
Yeah.
Try to exercise both physically and mentally. Physically, you do not need to take a walk at the park, even if you are locked down and there is some horrible virus wandering at the street of New York or somewhere, you can actually exercise at your apartment. Just do for fun few exercise. This helps a lot. Having a physical activity with healthy mind. And actually Chazal said that healthy body is related with healthy sleep. Secondly, you need to exercise mentally, solve puzzles, do whatever physically to exercise yourself. This normally will shorten multiple awakening during the night. And now when people with age will say, look, I need to go to the bathroom and pee. So this is typical for elderly, but it's also a symptom for, not for prostata, but for sleep apnea. So sometimes you should be aware that, these crazy psychologists tell us it's okay, but you should also listen to the body. So when someone say, look, I wake up, I go a lot to the bathroom, so I'm always saying, seek medical advice, and you should go to your primary care to make sure you're not diabetic, that you are fine physically. And if you are fine physically, then all our ACEs are good. Otherwise, ignore them. You should listen to them, taken that your health is okay.
Yep.
And this is important to mention. So now you mentioned, Pazit, one more thing, when it's the best time to waken in the morning. So if you look at technologies, and there are a lot of technologies, smartphone that pretend to tell you, my watch will actually waken you in ideal time. So you can listen to any fairy tale you want. I'm not sure it's yet invented. But yes, smartphone actually help you. If I need to now take the jet and go to New York, so I will prepare my sleeping habit to New York clock in Israel. So it depends if you are jetting east or west. There are ways to prepare for jet lag. But trying to schedule ideal awakening in the morning, it's still a dream.
Thank you. There's a question here privately. What is the average duration of sleep that expected to an adult and a mature adult? Let's say in the, between 40 and 80 plus years of age.
6 to 7 hours. And if you're a teenager, it will be like 8 hours. And if you are a toddler, maybe 10 hours. And if you're a baby, maybe 18 hours.
And the thing I always like to focus on is when people start to develop insomnia, though, they often focus on a number. I have to get that 8 hours that everyone says I have to get. I'm much more focused at the beginning on getting better quality sleep, and then we increase it to get you the quantity. Because if you're every night trying to attain a certain number, that actually puts more increased anxiety on you trying to get that number, that it actually makes it harder. So the goal is to first get better quality sleep, then increase the time.
Okay, there's a question here, a few questions that touch on the use of medication, meaning do you believe in medication to help sleep? And if somebody took medication and it didn't help at the time, can it help this time, or should they explore different types of medication? Tell us briefly, share with us about your beliefs and perspective about medication that are not over the counter or alternative.
So
I think, go ahead.
Yes. If someone, medication, it depends what. If you're speaking about sleeping pills, I'll speak in a minute.
Yes, yes.
But if someone said, look, I'm being treated for hypertension for years, and I sleep fine, and now something happened and my primary care physician have changed the prescription. It changed something in my drugs. And all of a sudden, I cannot sleep very well. So I would advise this individual, go to your primary care physician. It might be side effect of one of the drugs you are taking. So for most, and there are some trivial medication, believe me, that if you change the way you take it, instead of taking the pill, I'm just making up, 8 a.m., take it 8 p.m., and so on and so forth, you can manage yourself better. So when people said, look, I'm being prescribed for some medication for who knows what, and I'm having some sort of a shift of sleep, are you worried about your basic disease? So this is something which you can speak with your physician. Or is it side effect of drugs? So let's put this aside and speak about sleeping pills, meaning medically I'm all stable. So sorry to disappoint, but in Soroka Medical Center, at least for ourselves, and I have with me the pulmonary clinic, the neurology clinics, now the neurosurgeons are collaborating with us, and some other half hospital, and we are major hospital. We are really, we have, I think, close to 6,000 employees. We are the fourth largest, so we see a lot of discipline. In our hospital, we see, if you look at Jay's background, so this is one small, like fifth of the hospital is this, 1/10 of the hospital. It's huge. So we do not advocate for sleeping medication. For most of it, you can do without them.
Yeah.
And it depends. If we are speaking about grandfather or grandmother who are at senior citizen institute, you know, like elderly.
Yes.
So in there, pardon me, they're feeding with them with sleeping pills in order to get industrial quietness, which means the nurses will prescribe it so that everybody will be quiet. And this is doing wrong. It's actually malpractice. So we are actually saying, if you can do without it, do without it. There are so many things in the arsenal, and sleeping pill is not one of them. When do we do it? In very few occasions, and normally for short time frame, maybe for 1 week, 2 weeks. For example, if you would live near Gaza Strip, so you have a coronavirus now, but try to live near a suburb of Gaza. So it's part of our 40-kilometer range. So there, if people will take sleeping pills, they will be like drug addict. So we are not advocating. There are many other ways to cope with the situation.
Yes,
So
and yeah, go ahead. Go ahead, Tarasiuk.
Now, if you are really in force, so right now there are several natural, like for melatonin over the counter, it's useless, but there is other technology which called circadin, which is slow release melatonin, which is a natural thing, but slow release. So there are some evidence that taking this, it's not a drug, it's actually natural thing with slow release, and this may be beneficial, but try to avoid sleeping pills. It's actually worse for the body.
Okay, Dr. Harris, please. And I just want to say, along those lines of medication, I've had at least 3 questions asking about using melatonin.
Okay, can I just start with the medication just to
Sure,
figure out?
of course.
So here in the States, like the guideline is really by the American Academy of Primary Care. The primary care guidelines are to start with cognitive behavior therapy for insomnia. That is the guideline. And then if that's not working, then we move towards possible medications. So if someone is going for an initial insomnia evaluation, they really should be started with behavioral treatments, cognitive behavior therapy for insomnia. Then we look at, like was mentioned, obviously you're going to look at medication side effects, things like that that might be getting in the way. But things like routine are really important. A lot of that stuff, like routine, making sure you're getting out of your pajamas and you're actually getting light, you're going to bed at the appropriate time. Those are sometimes actually fixes that can really help the problem before starting someone on Ambien or whatever the medication might be. One other thing to note is there are some patients that just need medication, but if you combine it sometimes with behavioral and cognitive behavior therapy for insomnia, I see more patients come to me who are already on medications that have been for years. We sometimes then can reduce combining them. Maybe CBT for insomnia is not enough, but if you combine it with medications, you can take less medication. So we always start typically without medication, and then it's a tiered approach, but it doesn't mean you go full dosage of medication, which happens a lot of the time.
How long does it take to change habits? For the, I'm sure it's not a one size fit all.
I mean, it depends on how clean, shall I say, like if they have lots of medical or psychiatric. I've had some patients come to me, we make all the changes in about 3 weeks, 2 weeks, they start noticing some changes. Some patients it takes a lot longer, but the typical course of sessions is 4 to 8 weeks. Ends up being, if you space out the weeks, a few months. Most people have had insomnia for a long time, but you should see some changes in a month. Just to comment on the melatonin. Melatonin is one of those things where most of the people who walk into my office have tried varying doses, and it doesn't really do all that much. Melatonin's made in our brain naturally, and it comes out when the sun starts to go down. It makes us sleepy, so people are taking it to try and help them with sleep. We use it in the field a lot of time for people who are almost night owls and sleep really late, and various things. But with insomnia, the research is kind of mixed on it, and it's not the best of treatments, honestly. So, I mean, it also does cause dizziness, nightmares, vivid dreaming. It's not without side effects. And in the US, it's not regulated by any FDA or anything. So you don't always know what you're going to get.
Thank you very much. We have Rachel Heisler here asking a question. Rachel, there you go. Rachel, please. Let me unmute you, Rachel.
Okay. Question was submitted by a participant. My doctor diagnosed me as non-24. I'm sighted, and I am looking for studies that show presence of non-24 in sighted people because I need to appeal to insurance for denial of a drug called Hetlioz. Have you had success with this drug, Hetlioz? I'm currently falling asleep only between 12 a.m. and 6 a.m. on a rotating schedule. And also, what else can I do? No sleeping medications have worked for me. Okay.
Okay, so that is to anyone, including Dr. Selman, that want to address that.
This is a very, very complex medical situation, and the best person to help, the best professional to help this person is a sleep physician, because the sleep physician will, which is going to be an MD, will have experience with the medication, will have undoubtedly encountered the problems with insurance companies before, and will be the best one to try and help you. No guarantees, but that's really the way to go.
Thank you. Any other person that wants, I'm gonna put it on gallery view. If you have a question, raise your hand. Otherwise, we'll go to, I have here a few more questions as well. Do you have any question, any of you that are participating? Okay, I had a question here about how you, about how you speak with kids. Is it the same way? I mean, what is it? How do you approach in terms of communication, dealing with kids, with teenagers or all other ages that have a hard time to fall asleep? Please.
Shelby.
Okay. I think personally, teenagers with the trouble falling asleep, it was mentioned earlier, you know, the thing is that in our field, we're trying to get, at least in the US, schools start way too early, much earlier than they should for teenagers, because teenagers naturally go to bed later and they sleep later. So in a way, this is actually working for them. So there's a bit of a struggle that I'm hearing from some parents that they want their kids to, their teens, preteens and teens, to go to bed 9 p.m., 10 p.m. like they wanted them to for school. But if school's not starting until 9 or 10 in the morning right now, let go of the struggle. Let them go to bed later. It's okay. If that's just a biological shift thing that's happening because they actually naturally want to go to bed later, fine. If it's not that and it's more anxiety, it's more stress, we want to look at what are kids doing during the day. Are they in front of screens all day long? Is there any routine? Kids do thrive on routine. We don't have to come up with something totally scheduled, but try to give them a little bit of routine. I'm a huge fan of teaching meditation to kids. There's so many wonderful apps out there to practice meditation with kids. There's classes you can do online, and validation is a huge thing. So I'm talking, I have a 10-year-old and a 4-year-old. I talk to them all the time about this is not normal. This world that we're going through, there's no rule book for it. I'm trying to figure it out just as you are. Let's work on this together and tell me what you're feeling about. Really have them talk about it a bit. Doesn't have to be immediately before bed. I always encourage like an hour or two, but really try to wind down. And like I said earlier, make sure you're watching the screens, and also make sure they're getting outside and getting sunlight. A lot of the kids are so isolated, they're staying inside. Try, if possible, to get them outside moving around.
Great. That's a great advice for all ages, correct? Yeah. Yes, Dr. Tarasiuk, would you like to add anything about treating kids of all ages with difficulty to sleep?
No.
Okay, then we'll move on to the next question that we touched on before. What if you wake up at night and you're just mind, or even before you fall asleep, your mind, how do you quiet your mind? And what do you wake up just with bad dreams or bad thoughts, and it's severe, it doesn't go away no matter what you try, melatonin, meditation, whatever, nothing works. I have here a couple of questions from somebody in Florida. She tried for 30 years. She's had problems with sleeping, and she took some medication, and then she stopped taking medication, and after she stopped taking medication for many years, she started waking up at 3 or 4:30 a.m. Since then, she tried melatonin, meditation, CBD oil, and other. Nothing works, and I am now taking sleeping pills again for quality of life. Do you think that after having stopped taking sleeping pills for so many years, I should go back and rely on them? A participant from Florida.
I would say not necessarily. I mean, I have patients like this very frequently. From my standpoint, obviously we want to make sure there's nothing medically that's getting in the way of the early morning awakenings. If there's apneas happening or anything else that may be causing it. But if that's ruled out and this is more of a conditioned issue, the first thing I always do, like I said earlier, is see what their sleep-wake schedule is. Is there any dozing happening during the day? Tiny sleep episodes. And I have a patient that I spoke to this morning that's doing something very similarly. And we're trying, just by having them stay up a lot later, which can be hard if you don't have trouble with falling asleep, but by staying up later and doing that consistently, it sometimes can push the wake time later. And then you slowly, if they start sleeping later, then you slowly teach them to go to bed earlier. It's like you have to meet the body where it is and then trick it into getting more sleep.
We're approaching the end of our session. I want to really touch on innovation that's happening in Israel under the leadership of Dr. Ariel Tarasiuk that has to do with breath and remote medication. Tarasiuk, can you tell us a little bit about it?
So it depends. I'm not engineer by education, but after you work in a large medical center, and you mentioned Ben Gurion, so actually there is just small street that separate them, so you can think about it like a huge campus. So in this campus, we have, in the university now, we have engineers from all type, kind, and shape. So one of the things which we actually thought would be interested, do you think we need to stay asleep in order to diagnose sleep apnea? Do you really need to be monitored in a sleeping arena in order to capture sleep apnea? So what we actually found is that if you use speech, and actually I would give you a sentences to read, and I will capture your audio, and I will feed it into a computer. So maybe by just listening to the audio, not to the content of the speech, but the way the phonemes of the speech and the way the audio is being produced. So actually the muscles that regulate our speech actually regulate our snoring. Snoring is international language with no accent. Speech is more cognitive, so now we have accent. And actually think about it as machine learning that do not mind if you speak English, French, or any type of other language. It can actually capture some mathematical properties of your audio and tell about how sleep apnea is. Now, if you think about it, think about primates like monkeys, gorillas, and so on. So it depends if we believe in evolution or in mighty God. And it's so, but in humans, we had something changed in evolution in which we can speak, and this primate cannot sleep. They have limited vocabulary. So the ability to talk came at the trade of having sleep apnea, because the same muscles that are affected by sleep apnea are the same muscles that make us speak. So actually we found that there is several diagnosis approach in which you can read several stupid questions, sometimes free speeching, and it will tell you with a probability, very high probability, if you have sleep apnea. It's not necessarily that now you stop operating room, emergency room, operating room, but you actually think about it as a remote medicine now. And I see all of you, and each one of you is speaking to me. And think about an algorithm which will be in my computer, which as you speak will tell me by speech something about your respiration, about your sleep apnea, about what you're doing. And actually all you are doing now is telemedicine with me and telling me something about yourself. So there are technologies in a way to know about it. Other technologies which are of interest, do you really need a sleep laboratory in order to know if you are in light sleep or deep sleep? Or are you in rapid eye movement or not a rapid eye movement? And as you know, sleep has all these sleep stages, which traditionally have been scored by a manual been introduced by the American National Health Institute in the early 60s. How about if I will tell you that all I need is one small microphone in your bedroom, which will actually capture your respiratory sounds, inhale, exhale, and inhale, exhale. And via this microphone, this algorithm will be able to tell you with accuracy as good as sleep laboratory, as good as are you asleep or awake? So it will be like an actigraph. So now I can do it night after night after night, not even having a sleep laboratory. Or assume the machine with a different algorithm will be able to tell, are you sleeping in deep sleep or light sleep? Or as we do it now, are you sleeping a deep sleep, rapid eye movement sleep, or awakening? And all of this via microphone. Now, it has been published by a series of papers with many students. And with this microphone, now we can tell, are you having apnea or no apnea, just solely by microphone? And are you having apnea during rapid eye movement and not rapid eye movement? So with some people who are coming to sleep laboratory, take me and put me in a sleep laboratory, I will tell you, I will be sleep deprived. I will be so insomniac, worry about all these gadgets of what are doing to me. So I will not be able. So many people say, look, I would rather have my sleep tested at home. So I can tell you about zillion technology, a lot of technologies of how to do a good sleep study at home, which if somebody have told me 25 years ago that it was possible, I would say he was crazy. But in our days, you can measure sleep from your finger, and there are companies. You can measure it from microphone, and there are companies who are doing it via the mattress. In the mattress, think they are putting some pressure sensors. So all of these technologies, for example, can help in, this is a funny situation, we should call it COVID-19. So think about it, where people are having sleep problems, cannot come to us, but with a microphone in your smartphone, I can listen to you, or an algorithm can listen to you, and it will be sent to some sort of a stupid cloud, and you will get a message the next day what to do. So there are many technologies. Now, you know how it all started? It all started via this PC. So when I was a student, it was Apple II. So we had an Apple II, and I remember Steve Scharf, that practiced in Maryland now, used to show it. He was chief of pulmonary, now he's in Maryland, used to show us. And when I graduated, there was the 486 computer, which couldn't do much. But the 486 actually cheapened the technology. Now you could afford it without no polygraph. And now in our day with this stupid telephone, it's 20 times, 100 times stronger than the 486 chip.
And they say, "Ve'haya dod netuya." It means in Hebrew.
Yet to be developed, yes.
Right.
So I think in our days, yes, sleep laboratories are necessary. No doubt about it. Because not everything is being treated remotely. But yes, there are technologies today to fill the gap, at a time, for example, like now, where you need telemedicine and remote medicine. So yes, when people said about health insurance and how should I claim whatever, so in Israel, we are all by national health law, I am being deducted maybe 4.5% of my paycheck to national health insurance, which is mandatory. And I can now have something from a broken nail to brain replacement free of charge. So we are not faced, I'm not familiar with it. So these HMOs in Israel need tools to access the public without whelming the clinics. So yes, there are many technologies being developed, which yet to be validated against good standards, and this is quite tricky.
Thank you very much, Dr. Tarasiuk. We're almost done with the session. There are so many more questions, so I really apologize if we can't answer everything, but we have 2 quick questions before we complete. And one is, it's 2 questions in one. One is, when I wake up in the morning and I'm still tired, what do I do? And that is also leading to the next question. When do I know when I need to seek professional help, and where do I find the best fit for me? Dr. Harris.
So I think, thank you. So I think the thing is that if you're concerned about your sleep at all, I'm a huge fan of just taking out a sleep diary. So you track your sleep, what time you're going to bed, what time you're waking up. If you're waking up in the middle of the night, don't look at the clock, just kind of guesstimate, because otherwise it can make it worse. You can get them, I have one on my website, you can get them all over the place. Just look up sleep diaries. If you're getting what would be thought of as a sufficient amount of sleep, 7-ish, 8-ish hours a night, and you're still waking up tired and you're doing all the sleep hygiene things right. You're not having caffeine at night, alcohol, not taking any medications that could cause drowsiness. Consider talking to your physician or talking to a sleep specialist, especially if you have any snoring issues that are going on. That's really important. And then was there a second part that I forgot?
Yeah, when do I seek professional help, and how do I know what's the best type of help is
I would say
for me?
If these basic things, you're tracking your sleep, you're trying to get enough, you're following basic sleep hygiene, you've done some CBT for insomnia. If you have insomnia, there's nothing else medically that you're concerned about. If that's not working, talk to either your primary care doctor, or at least in the United States, we have some excellent sleep centers. You can go to the American Academy of Sleep Medicine, and they have a list of sleep centers that you can go to. But oftentimes your primary care doctor will be able to direct you to the right person to go.
And before going to Tarasiuk with this, and read this book. This is gonna answer a lot of your questions. And if today you're contributing to Soroka's COVID-19 response fund, amount of $180 or more, we will send you the book with the author's signature. So here you go. This is soroka.org/COVID. We welcome your contribution for Soroka. Yes, Dr. Tarasiuk.
So when to seek help, we actually use a simulated patient model to explore it. So what we did, we called it Mrs. Shmohor, and she came to the primary care physician with a scenario which we educated her, and she repeated it with her doing something happening to her husband, and we checked how primary care physician work and who could guess about the best way. So what we found out that if the primary care was graduated from Israeli Medical School of Medicine, he could guess it very well. And it depends from which type of school it got its education. So I would say for United States, most board certified primary care physician, American board certified primary care physician are good. And if you will come to your primary care physician, it will tell him or her, of course, your story, but organize your thought before you come to the clinic. Like prepare a note with what you want to say. Because one of the things if you should seek answer, we tell our patient, do you remember where you put the keys to your car? Do you remember where you put your whatever? Did you organize whatever you need to do? Could you mention 10? So if you have this shortness of memory, that's a good thing to seek for help.
Mhm.
But if you organize your story, and you say, look, I'm with the office with him and so on, and you organize your question, you'll come to a primary care physician, and he will refer you to let him worry about it. And he or she will refer you to pulmonary. It might suggest some respiratory thing, and you might have, I'm just thinking, asthma or non-balanced or non-organized, whatever. If it's suggesting neurology, he will send you to a neurologist. And if he will think it's something to do with the mind, he will send you to a psychiatrist. Do not try to be the specialist. Go to primary care, and I'm confident you will get referred to a reasonable clinic. Remember, for most of it, you do not need sleep center. You do not need a sleep laboratory. All you need is common sense, organize your diary, think about what you ate, type of diet, what you ate. Did you sleep much? Not. Are you nervous or anxiety due to objective worries in your life? Problems with children, with spouse, with whatever. For most of it, if you can answer reasonably enough to yourself, you do not need any doctor. Rationally, you will treat yourself. But if it's a persistent, I strongly recommend go to your primary care.
Thank you so much. So we're beyond time. The one last question is a personal question to you. We always like, you know, beyond the professional to end with something very personal. You both, and all of you, and of course the president of the board as well, and all of you, many of us here helping other people, doing really great work in changing, creating a change in people's lives. What is one moment that you recall being most proud of, one of your proudest moments in helping other people, some breakthrough or just some personal satisfaction and pride that you felt in your heart? I know it's a question you didn't prepare for, but I'm sure you have more than one to share with us. So who wants to go first? Yes. Yeah, what, Dr. Selman, you want to go? And then Tarasiuk, and then Harris will conclude.
I think that rather than some grand moment, which happens to us occasionally, it's being able to connect with a patient who comes to an office. I'm now seeing just kids with a child with a problem, and to help the parent and maybe the child understand what the problem is, what are the steps that we can take together to try and help the problem. We often cannot cure, but we can make things better. And we usually do that with one small step at a time. And that's approach to many of the sleep problems and many other problems. And thank you for organizing this.
Thank you, Dr. Selman. Dr. Tarasiuk?
I will tell you, in the small spot where in the big jigsaw puzzle, which I'm at, medical education is important, to my opinion, both from teaching the professional and trying, we do not patronize everybody. We try to show the way to the public. But if I will say something that made me really proud, you know, in Israel we have a co-payment, and co-payment it's a big deal. One of the co-payment is for CPAP, for continuous positive airway pressure treatment, and you can find EPAP, VPAP, BPAP, all this technology. Now in Israel you need to co-pay for this, and co-payment it's really a barrier toward treatment. So according to our National Health Service, there is a certain amount you need to pay. So one of the things which we did by our National Health Institute in Israel is try to look at a way to alleviate barriers toward treatment. And we said, what actually help patients commence their treatment and sustain them? So one is educating or trying to lead the subject himself and his spouse and his whole supporting arena. And the other one is, can you really try to find a way and tell all this government, maybe not everybody needs to pay for this. So we found an algorithm or a way to look at actually say who should not co-pay and what is the way not to co-pay and actually affect the regulator. So I think this is important because sleep apnea is involved obesity, and obesity is involved with poor and socioeconomic deprived population because they do not eat well, so they gain weight and their sleep apnea is not good. So we found a way of who to subsidize and who to encourage in order to provide better health, especially in our area where, I don't know if you know, but Soroka Medical Center, in the suburb, maybe the Bedouin population of the Negev is 18%. But if you would walk in the aisles of Soroka, 50% of our customers are Bedouins and very poor socioeconomic people. So finding a way to support socioeconomic deprived population or minorities, and there are some other minorities, very, very important in modern society. And we also see, not related to the subject, a lot of Palestinian, although they are not part of Israeli healthcare system, but we give them tremendous amount of medical care, and this is very important.
So Dr. Tarasiuk, you're saying that the peaceful coexistence and helping that big, diverse population is one of the things that make you very proud.
You know, we can speak about many things, but when we see people from Gaza or from Mount Hebron, from Palestine, come to us and they go with joy home, I cannot be more happy.
Thank you very much. And as we, in preparation, Dr. Tarasiuk shared with us that this is not the first traumatic situation in the Negev of COVID, because there are so many happenings going on in the area. So they're dealing with a lot of anxiety all of the time. Thank you for everything you do. And Dr. Harris, do you want to share with us one of your proud and emotional moments that you've had helping people with their sleep?
I think it's, for me, it's honestly, it's the people who have been either on medications for years and that either worked or didn't work that well and didn't think that there was any other option, and helping them get off of these medications that were very difficult for them to get off of. And seeing that there can sometimes be light, not all the times, but there can be light at the end of the tunnel, and it doesn't always have to be medication, and it can be very rewarding.
Thank you very much. Thank you, the experts. Thank you, the participants. Thank you, the Soroka Friends Leadership, Executive Director Rachel Heisler, and everybody. Check the recorded session on soroka.org and have a great week. Thank you.
Thank you, everyone. Be well.